When I first felt step one, I really want to get more support and want to hear more stories about other people and how they conquer that fear, still match and become a physician. First of all, mentally, you have to tell yourself that you are good enough. I think a lot of medical students, we're so type A and we love comparing ourselves to each other and we only focus on the ones that is like super smart and did everything better than us. But we have to take a moment to tell ourselves that we got to this point and there is something valuable in us to help us through this journey. One thing that my therapist does with me, like right before I take step one and step two, is
Mm.
to go over that day mentally. And she will have me close my eyes and think about what happened that day. It will be super detailed. You go in, you check in, you go to the bathroom, and you come back. You start the first block, and she will ask like a lot of questions during the way. It's like asking, "Oh, what if this block is bad? What do you feel now?" And then I have to go through that. Oh, I'm really anxious now. And then she would tell me, "No, you don't have to," and just kind of guide my mind through the whole day. She would suggest any scenario pop up, like maybe I run out of time on that block, or maybe I don't know this material at all. Like what happened? I think doing that really mentally prepare me to what happened during the exam. So I feel like as human, like if you already practice your brain, like, okay, this is going to happen, then in the real experience, you will feel more comfortable.
Yes. Oh my goodness. That's amazing. Awesome. Hello, everyone. This is Dr. Moss from the Life as a Patient Doctor podcast. I am very excited to interview Mary, who is a USMD student who'd matched in her top choice internal medicine program. She had a failed step one and 2 years of leave of absence for mental health. And did I say she's still matched? Amazing. Thank you so much for being here.
Thank you for inviting me. It's my honor to be here. Like you said, I am a USMD student, and I think a lot of people, when we look at like fail step one or taking gap years, there's not a lot of YouTube video out there to help other students. And I think 2 years ago when I first fell step one, and I really, really want to get more support and want to hear more stories about other people and how they conquer that fear and then come back and still match and become a physician. Therefore, I think I'm here today to share my story and hopefully encourage other students going through what I went through 2 years ago.
I love that. That's amazing. And I think that is a similar thing for me of why I decide to also share my step failures and leave of absences. Because you're right, just no one talks about them. It's not like they don't exist.
Exactly. And I think it's like because we're like super type A and medical student is like what top 7% intelligent people in the world. So nobody really think about that. We actually can fail and we will go through failures.
Where did the step failure specifically go in? Was it during your leave of absence, before, after? Where did that go in your journey?
So I think a little like small background, I am always like the top student since like high school and college, and I graduated with 4.0 and go straight from college to med school, and also one of the youngest student in my med school. I goes to like a mid-tier SMD school. And I first 2 years, I really studied super hard for school exam. I think the problem is I focused too much on the school exam and I didn't realize that my school, when they do the school exam, is nothing really like the actual standardized test exam. And that is actually the help that I really need because since like ACT, SAT, and MCAT, like I always have test anxiety and problems finishing the test on time. Somehow I can get a decent score and get to where I was 2 years ago. And then COVID hits. Back in the days, I'm pretty sure it was my second semester of medical school. They shut down all the in-person learning. They shut down the anatomy lab. I just feel very isolated. And I'm sure like a lot of people, not even just students, like people in general just feel a lot of like depression and anxiety during that time. And I didn't really realize that, pay attention to that. And then I go through second year and do the same thing, focus so much on just school exams. I didn't really do much practice question until dedicated, which I regret a lot. But then back in the days, I'm just like, everyone tell me like, oh, you're so smart. Like you always get it. Your exams is always like the top 30%. You will get step one. Like it's nothing. But when I start studying, then I realized that it's so different. The questions are tricky. Even if I know the material, I don't know which one is right because there's always two of them.
Right.
I don't know which one. I did really bad on my practice MBME. They have us to take it before we can go into dedicated, and we have to pass. I didn't pass. and I start panicking. I only have 6 weeks to study for this, and I'm failing right now. And it's not by 1 or 2 points, it's by like 20 points. So I'm like, okay, so what should I do now? And then the more I panic, the less I want to study.
Yes.
I think I just really overwhelmed with the fact that, oh my God, what if I fail? My life is going to be over. I am going to not ever going to get my dreams come true. So I get really depressed, really anxiety. And eventually I got to the point that even opening my computer every day is a struggle for me. I look at my schedule, I'm shaking. I know there's something wrong with me. So I went to see one of my school dean and talk to him about it. And he's really nice that he told me that I could extend my dedicated to a couple weeks. So it went from 6 weeks to a month and a half. But at that time, I still feel like, oh, I got this. I don't need any mental help. I don't need a psychiatrist. I just need to rest and I can do it, which is a mistake because eventually I just go in without really finishing studying as much studying as I want because of anxiety. And then I got COVID right before the exam. And that is the absolute last day before I can graduate on time. So I have to take it on that day. I went in and basically blank out. Like I just remember first section and I'm like, oh, I don't know any of these. I'm just guessing. It went to a point that I was having a panic attack during the exam. That was when I realized I really need to look at my mental health. And I feel like mental health now is still kind of a stigma. Anyone that say, "Oh, I'm depressed," and a lot of, especially older generation, like my parents, they're like, "No, just do it. Just tough it out. What is mental health? Back in the days, just tough it out." And I don't know what depressed means. Like, life goes on. And then I eventually convinced them that, oh, I felt this and really need to look at my mental health and see what is going on because I know that it's not normal for me. And then I seek help and is really lucky enough that our school has a lot of opportunities for us to get like a psychiatrist appointment and also counseling and therapists. So the first year, I still have that tough it out kind of mentality.
Mm.
And together with peer pressure, together with my parents' pressure, then I feel like, oh, I just need to study. Like I just take breaks and now I have a whole year. I can have as much rest as I want it to be. And then eventually it got to March 2022. Then I realized that it's the same exact things again. I am having like only 2 months left before I have to absolutely take my step one again and pass it so then I can move on to clinical. I'm having a panic attack again because I feel like I don't have enough time to study. I don't have enough experience with the practice exams. I didn't finish UWorld. Everything is collapsing. So I went to my dean again and we talk about it. And then when I realized that I need to focus on my mental health. Second year is really when I seek help with psychiatrists and therapists and work closely with them, taking some medication for it. Slowly and gradually, I can study like 1 hour a day for a couple weeks and then 2 hours and then 3 hours. And I just build up that tolerance until I can actually get into my dedicated. This time around, I feel confident. And I actually did everything that Reddit told me to do. I did all the UWorld, Sketchy Farm, Micro, and Pathoma. I just did everything. I don't know if I actually need to do everything to pass, but I feel better. I feel more prepared. So this time around, and I also like with my therapist about breathing exercise. And when I feel very anxious during the exam, do a power stand. And then I think that really helps me to survive that test day because it's a long day.
Oh my goodness. Yes. Oh, wow. What a journey. Thank you so much for sharing that, both the ups and downs and the reality. I connected so much with that. And it's so interesting when you're saying second year of COVID. I think you're in like my same year of class. That was when COVID hit. So many people during that year, I think in my school alone, about 20 individuals had to take a leave of absence to do step. Step is already stressful enough. And then you add in the layer of the whole world being virtual and everything going on. I also really like that you talked about how the family and peer pressures of always being told you're smart and you kind of building you up, but not all the times does it have the same internal effect. It actually sounds like it had the opposite effect. Instead of making you feel smarter, the struggle of just being able to sit and study and then failing the practice test, like, I'm sure that was also a significant aspect of just having worse anxiety and trouble sitting down. Am I thinking that correctly?
Yes, you're exactly right. I think that is definitely a biggest factor because you're already very anxious about the exam. You want to do the best you can. And at the same time, because you're anxious, then you can't really study. But then other people keep telling you that you got this. Just think about after exam, like what you can do. And then I'm like, I can't even study right now. Why you keep on putting more pressure on me?
Yes, exactly. That external pressure. Like already you're putting so many internal pressure. You already have pressure from the medical school saying you can't graduate or start clinicals.
Exactly.
What about step two? How did that change when you started going into your clinicals and then step two?
I think like passing step one really give me the confidence that I needed. And I know that a lot of people say like, oh, when you're studying for shelf exam during your third year, you should do UWorld and aim at like finishing the first pass of UWorld and then do your incorrect during dedicated. And I think that's what I did. I try my best to do divided how many days I have in this rotation and like how many questions should I do each day on UWorld to prepare for the shelf exam, which I think prepare me well. And also that confidence that, oh, I can actually sit through like an 8 hours exam now. Like shelf exam is only what, 4 hours or two and a half is nothing. And also because during the whole year, I use UWorld and study along the way, then during dedicated, I don't feel as nervous. I feel like I know the material. Now I just have to remind myself that, okay, these are the mistakes that I always make. So let's try to remember and not make them on the real exam.
That's a really good point. How did you learn from those mistakes? Was there a specific strategy that you found that was helpful for you?
Yeah, I like writing things down.
Hmm.
So whenever I have the first pass review world, I get a wrong question, then I will mark the question number and then I will write down whatever information I needed to get that question right. And then during dedicated, I review that book.
Would you do the general topic or like a specific detail?
Specific detail.
Okay. No, that's good to know. I recommended because I did that too, but like I just did more general thing like, oh, I have to go like, oh, I have to go review this specific part of cardiology or this specific disease. But I like that. And did you by any chance use the UWorld? They have a UWorld notebook. Have you seen that?
I don't like it because it would save me a lot of time, but I like writing things. I think writing makes me remember it more.
That's a good point. There is something using the kinesthetic and the visual. I totally agree. That makes sense. Okay, so congratulations then. I'm guessing on the first time you passed step two.
Yes, I did.
What was your thought on it? It sounds like you were diagnosed with anxiety. Did you ever consider doing accommodations?
I actually don't even know that exists, to be honest, because our school just never really talks about it. I don't know anyone that is going through the same thing that I am going through. So I think one time when I meet with my therapist, she did mention that, oh, you can do accommodation because I'm diagnosed with depression and anxiety. She said that it would go through a very long process and they don't really approve it. So then I just kind of put it in the back corner.
Yes. It's so hard that schools, because the school did the same thing for me and so commonly to other medical students because, mental health is stigmatized. So they're just this push of, oh, mental health doesn't exist. Let's just not talk about it. But I've helped so many medical students get accommodations because they need it. Like, whether for anxiety, whether for physical things, just like that ability to go do. I love that you said the Superman pose. Like, for those who can't see, it's like, standing like this. I did that during my step three. I went and stood in the bathroom like, okay, I got this. But yeah, especially something to consider for step three is because now it's over 2 days. And so 2 days of 9 to 10 hours or 4 days of like 4 hours. But yeah, different things. It is out there. You qualify, and everyone who has any type of mental or physical diagnosis qualifies. It's just it takes 60 days to submit to wait till you hear back. Anyway, I'll link the episode where I go over accommodations for everyone and I share my personal statement and letters that both my therapist and doctors did so you know what they need to include, like the DSM criteria. Yes, it's so bothersome that people who need it and just by showing you have a failure even shows even more you need it. But anyway, going forward to residency and internal medicine, why did you choose internal medicine? Why did you go down that?
I think I really like the human interaction with the patient. I really like how I can build a relationship with my patients. I know that I want to be primary care to begin with. And then also, when I do my IM rotation, I really like the hospital medicine part. In the hospital, you can see a lot of different cases. You learn to take care of critical patients, which fascinate me sometimes. So I think that's why I would like to do that.
I love that. You'll definitely get internal medicine always has the best cases. Everyone who goes to the hospital, I feel like they go ED and then most of them just go straight to internal medicine.
Mm.
Something that I get asked all the time is when you're applying to residency, do the individuals who interview you ask you about your failure or your gap year? What was your experience?
So I was really having the same question too when I was submitting ERAS. Should I put it on my personal statement or not? That's the biggest question. I asked many like faculty, like my mentors, and they have different opinion. And eventually I didn't really mention failure because for me, it is like a two parts. It's like I have a failure and I also have the mental health. So I did just a little bit kind of saying that I have a mental health challenge. I didn't really include what is it and the failure of step one because I do learn that some program they only give the faculty the personal statement and nothing else. So I kind of don't want to like raise the red flag for them in the personal statement. And then in terms of interview, I did get asked a lot actually, and they are always pretty nice about it. Some program didn't want you to tell them. So they're just like, "Oh, is there any like challenges during your medical journey?" And then I just explained that.
So you decided to do the failure as answering the challenges.
Right.
Reason that you did that versus a LOA or another challenge in medical school?
Because I think in my case, everything on my application is pretty adequate. That is the only thing that is like questionable. At least I think they would be questionable. So I really want to answer their concern and just tell them that like this is what happened and it's just like a situational problem and I actually conquer it and I passed step two and get a decent score and now I'm here and ready for residency.
I love that. That's such a great way to kind of explain it. It's not just to talk about the failure, is how you got over it and what you learned from it. I'm really glad that you were able to describe that. And it obviously worked for you, right?
Yes.
What would you recommend other students do who are about to go into the new residency cycle? From you going through the match and all your different challenges, what would you recommend for future applicants?
I think, first of all, mentally, you have to tell yourself that you are good enough. I think a lot of people, especially medical students, we're so type A and we love comparing ourselves to each other. And of course, everyone we look, we only focus on the ones that is like super smart and did everything better than us. But we have to take a moment to tell ourselves that we got to this point and there is something valuable in us to help us through this journey. I think that makes you feel mentally better and then start doing all these, complicated kind of daunting work of like application. I think that would make the applicant feel better.
Did you feel imposter syndrome ever really took hold of you during that time?
Yeah, I think so. And especially with like fail step one and two gap years, I feel like, oh, it doesn't really matter. There's a point in my life. It doesn't really matter how much I do well now because I have a failure. So it's going to stick with me forever. But this is not true.
Yes. Say more about how it's not as big of a deal because we definitely in our minds make it out to be. At least I know I did.
Yes.
I know you mentioned that your psychologist was helping you out with
Mhm.
different mindfulness strategies. Anything that you can recommend for other people going through step one or step two, or things you'll bring in for step three?
Yeah, I think there's this one thing that my therapist does with me, like right before the last session before I take step one and step two, is
Mm.
to go over that day mentally. She will have me close my eyes and think about what happened that day. It will be super detailed. You go in, you check in, you go to the bathroom, and you come back. You start the first block, and she will ask like a lot of questions during the way. It's like asking, "Oh, what if this block is bad? What do you feel now?" And then I have to go through that. Oh, I'm really anxious now. And then she would tell me, no, you don't have to. And just kind of guide my mind through the whole day. She would suggest any scenario pop up, like maybe I run out of time on that block, or maybe I don't know this material at all. Like what happened? I think doing that really mentally prepare me to what happened during the exam. So I feel like as human, like if you already practice your brain, like, okay, this is going to happen, then in the real experience, you will feel more comfortable.
Yes. Oh my goodness, that's amazing. I will be taking that and I will be using that. And I'll definitely using that when I work with medical students. The visualization is important when we're recommending visualize things going well. It's interesting you said visualize things not going well and then overcoming it or still keep going as if it didn't happen. That really caught me. When we're anxious, we get worse and worse, like what ifs. But having that second person, whether that's a therapist or a partner, a friend saying, no, you don't have to be anxious. No, you can come back from it, I'm sure was really helpful. Thank you so much for sharing all this. I think a lot of individuals will appreciate this, whether they're about to take step one, they failed one of the USMLEs, or are just in the same journey of deciding what they'll do for their residency application. I think this will be a very helpful for a lot of people. So thank you so much for sharing your journey.
Thank you for giving me the opportunity to share my experience with all the other students in the world, and I really appreciate that.
Oh, you're welcome. And yes, that is such a good point in the world, not just USMDs, MDs all over the world. And so I like to do at the end, I kind of like to review everything, kind of give a summary. So you are a USMD, you were a second year during COVID and struggled right before dedicated, did not pass your practice exam by a lot of points. So that anxiety really impacted you. And it got so bad that you you struggled to even open and study. You reached out to your dean and you did get an extension for your dedicated, but still it was really hard to just do all those UWorlds and not do your very best. You ended up taking an extended time off that you were able to have that opportunity. Unfortunately, you did fail that exam. So now having to take it again was really challenging because you had to go against your own self doubt and then kind of this pressure from family, from friends, from medicine, from the school, and really try to step away from all that. You were able to reach out and asking for help both from a therapist and getting medications, also learning how to use mindfulness and visualization. You were able to make it through the second take and pass, and then go back into clinicals, did well on clinicals, did really well on step two, and matched in your top program in internal medicine. You gave advice for individuals to remind yourselves that you are good enough, that there is always something you can do to improve either your testing or your mental health. There's a possibility. It's not the end of the world. And I always like to say for people that you are not alone. And this is why we share these stories. I know that in medicine, we like to share the positives, we like to share the winners, but it's equally important to show the challenges. Each of us go through different challenges and have our own journeys in medicine. So just remember you're not alone. And hopefully, this interview helped you If you want to learn more, I've interviewed a couple other individuals who have failed either step 1 or step 2, and now me, step 3. So I will put those episodes down so you can see those. I'll also put the accommodations video. So if you've diagnosed health condition, just check it out. Like it does, not just for you. I'm talking people who are listening. It's additional help, just an additional tool. You deserve it. Anyone does if they have a struggle and a need. So anyway, thank you, Mary, for joining us. And thank you, everyone, for listening. Make sure you like and subscribe to Life as a Patient Doctor or Dr. Moss on YouTube. I'll see you all next time. Thank you again, Mary.